All right, let's go ahead and get started then. Thank you everyone for joining. My name is Claudia. I am an associate with CalPERG, and I would first like to say a huge thank you to our panelists, or our speakers who are joining today, Dr. Richard Pan, State Senator Matt Leger from SEIU, California, and Alize Weber from Get Us PPE, and to everyone who is attending. Great, so I will just kick us off by talking about the report briefly. So a new report from the CalPERG Education Fund and the Frontier Group has found that California nursing homes, along with thousands nationwide, are dealing with truly horrific shortages of masks, personal protective equipment, and other types that they need to protect residents, workers, and the broader community from COVID-19. When nursing homes don't have enough PPE, it can lead to outbreaks amongst residents and staff, worker quarantines and shortages, and causes more risk towards workers and residents' families and neighborhoods. These ongoing shortages are particularly concerning as the country is expected to see a winter surge of COVID-19. Here in California, we have had nearly 6,000 deaths from residents and staff at nursing homes and assisted living facilities, which accounts for more than a third of the total deaths in the state. Our report analyzed data submitted to the Centers for Medicare and Medicaid Services by the nation's 15,000 nursing homes, including over 1,100 here in California through the end of August this year. I will now share my screen again quickly to share some of the key takeaways from our report. So this first slide shows a graph of the residents who are at heightened risk of contracting COVID-19 because their nursing homes were out of or were dangerously low on one or more types of PPE, such as N95 masks, gowns, or hand sanitizer. At the end of August, there were more than 220,000 residents who were at risk. We also saw that 8% of nursing homes nationally were completely out of one or more types of PPE in late August, and 20% of facilities had a less than 1 week supply of one or more types of PPE, which represents a critical shortage by industry standards. In fact, and very troublingly so, PPE shortages in nursing homes actually tripled across the country from mid-July to late August 2020. You can see on this chart here that the shortages really had a very concerning jump. And the previous slide being having absolutely no supply of different types of PPE, and this showing a less than 1 week or a critical shortage of supply. Here in California, more than 7% of our nursing homes had no supply or a critical shortage of N95 masks in August. And a larger portion of California nursing homes had a critical shortage of both gloves and of hand sanitizer than compared to the national average. So it is really just unconscionable that we are still dealing with severe PPE shortages at this point in the pandemic, especially in nursing homes where some of our most vulnerable community members live. Without proper PPE, nursing home cases can spread rapidly, putting residents and workers at risk both inside and outside the facility. So next, I would like to invite Dr. Richard Pan, State Senator, to speak.
Thank you so very much, Claudia. And I want to thank CalPERG for putting together this report, which shows the vulnerability of our nursing home seniors to COVID-19, but also to remind everyone that infectious, contagious diseases are out there, and COVID-19 is just the latest example, one that's certainly very severe, and reminds us why it's so important that our nursing homes and other health facilities have a sufficient supply of PPE. We don't have a treatment or a vaccine for COVID-19 right now. And in order to stop its spread, particularly in our most vulnerable places like nursing homes, we need to be sure that people have the protective equipment they need to both keep themselves safe, but more importantly, to keep patients safe. This helps prevent the spread of the disease. So when nursing homes or other health facilities don't have the PPE they need, then that means that disease will spread. They'll spread both within the nursing home and will spread outside the community. And so it's so important for our country that we have that PPE. The PPE, by the way, is also the foundation for being sure that not only are people being safe in nursing homes and hospitals and other health facilities. For example, when we are testing people who might be positive, people need PPE. We have essential workers who need PPE. So there's a lot of people who need PPE in order to keep themselves safe, but also to prevent the spread of this disease. And I want to remind everyone, these are contagious diseases. Anyone who has it or catches it can then pass it on to other people. So when people do have the PPE, it's much less likely they catch the disease, which means they're less likely to pass it on to anyone else. It grows exponentially. So PPE is an essential part of the strategy to slow the spread or even stop the spread of this disease. So what happens when we don't have enough PPE? Well, people are at risk. And actually, it's shocking that the White House is actually considering a strategy in which they want the disease to spread in the community, but say, well, gee, we can sort of isolate the nursing homes. Well, first of all, that's not possible. Second of all, certainly not without PPE. But even with it, I think it's a questionable strategy. However, the problem is, even when we don't try to spread the disease, we're still having problems right now. We don't have people wearing masks in certain areas. We have a lot of problems. And then the other issue is that where's that PPE supposed to come from? So we know the president knew that this was a serious virus, at least since February, if not earlier. And yet only the president of the United States has the authority to invoke the Defense Production Act to ensure that we have a reliable supply of the things we need, like PPE, in our country. And yet months have gone by and that has not happened to the degree that we need it to. Here in California, we actually did take some steps to try to secure our own supply of PPE. And I think what you see in that chart was that California is doing better than most other states, but we could still do better. And certainly I'm proud to have authored legislation sponsored by SEIU, SB 725, to be sure that we are better prepared for the next outbreak, to be sure that our health facilities have a stockpile of PPE. Although I will point out, though, even having a stockpile of PPE in itself, what it does, it buys time for leaders to be able to act. And if leaders aren't going to be acting to then restore that supply chain of PPE, we will still have the same situation we have now. So we do need to be sure that we have stockpiles of PPE, but more importantly, we also need leadership nationally to make this happen. So I know we're here to talk about this report, but part of the solution to this report is to vote for people who actually believe in science and will prepare our nation against contagious diseases like COVID-19. So what all of you can do is be sure you vote this election, and then we need to call our leaders to account to be sure that we have the supplies of PPE necessary to protect our seniors, to protect the people who are working in our facilities, to protect other patients, and to protect essential workers, and ultimately protect our country. So again, I want to thank CalPERG for putting this report together and to identify the gaps that we have, and again, reinforcing that even this many months into the pandemic, we have still not done enough to assure that there's enough PPE for our health facilities and for our country. Thank you.
Thank you very much, Dr. Pan. Next, I'd like to invite Matt Leger from SEIU California to speak.
Thank you, Claudia. So my name is Matt Leger. I'm a government relations advocate with SEIU California, and we represent 700,000 workers across California, including more than 20,000 nursing home workers. And we know when this pandemic hit, we heard directly from them that there was just not enough PPE, and they were really being forced to improvise or go without. And so we had workers doing things like wearing raincoats and then disinfecting them in the middle between patients. And it's completely unacceptable. It's not a good quality of care. And they were forced to do that because we just didn't have a sufficient stockpile and employers didn't have enough of the inventory. So when the supply chain broke down, workers were forced to do that improvisation. And many nursing home workers in particular, because of the relative low pay, are forced to work multiple jobs. So even if we're trying to do a really good job of containing it within one nursing home, they tend to, there's the potential to spread just because workers don't have the protection they need. And then also they're forced to work at multiple facilities. In addition to that, workers every day were scared of going home and exposing their families. Because they didn't have the appropriate protective equipment. They were worried about exposing, particularly when they live in multi-generation housing where, they may have an elderly a family member that they're taking care of. And so we know that as of October 25th, local health departments in California have reported more than 43,000 confirmed cases of healthcare workers getting COVID-19. And unfortunately, more than 200 deaths statewide, and that's just in California. So it really, in response to our members' demand for more PPE, because we were getting a call every day, what can you do to protect us? We, SEIU, sponsored SB 275, and we were incredibly honored to have Dr. Pan and Senator Leyva show their leadership and author the bill, which did get signed into law. That bill ensures that nursing homes, hospitals, and other health employers have 45 days of pandemic level PPE to buy that time that Dr. Pan was talking about. But then it also sets up a framework for the state to create a state stockpile to just buy even more additional time. And so we know that a state stockpile is potentially expensive, but we know the cost, especially when we're seeing the issues persist of not having enough PPE. We know how important it is. And so we will continue to advocate for more PPE and for the state to continue to be prepared, not just to fix the issues that are occurring during the COVID-19 crisis, but also to be prepared for the next crisis so that workers are never forced to go without again. And then in addition, we need, from SEIU's perspective, more transparency into the distribution of PPE that we do get as the state, because we know some of the smaller facilities like nursing homes often are not able to get the same PPE that some of the larger facilities, like large healthcare systems, are able to purchase on their own. So with that, I'll throw it back to you, Claudia.
Thank you so much, Matt. Yeah, the lack of PPE is hugely concerning, with the risk to workers as well, as we go through. And I would now like to ask Alize Weber from Get Us PPE to speak a bit about her experience on distribution of PPE.
Thank you so much, Claudia. Like Claudia said, my name is Alize Weber. I'm the Deputy Director of Operations at Get Us PPE. Get Us PPE is a donation platform for protective equipment. We accept anything from masks to gloves to gowns to hand sanitizer. And my role is to really make sure that we distribute the donations that we receive from the donors to end recipients, and particularly to those that need it most. We got started in March of 2020 by emergency physicians that had witnessed firsthand the difficulty of accessing PPE. At the time, we were very much a grassroots movement and expected to be around for maybe a couple of weeks, up to a month. We were expecting really for a solution to be reached at that point and for the shortages to slowly disappear. Obviously, as per the point that were made by Dr. Richard Pan and Matt Leger, this is not the case, and we're still very much needed at this point. We have grown to be an organization of close to 200 plus volunteers, and we are now the largest database, non-governmental database for PPE shortages and the need for requests. We serve a variety of facilities. We started really focusing on hospitals as they were, the priority and the more obvious people to start with. And it became really quickly evident to us that we needed to expand our definition of what frontline workers were. And we have started really looking at a number of other facilities and social services organizations, including long-term care facilities and nursing homes. Really something that we have seen is a shift in the need and who needs PPE and the kind of PPE that is needed. It used to be the case that no one could access PPE because there simply was just a shortage of it. But now the case is there are more suppliers and there is definitely more supply coming in. But the issue for smaller facilities is that a number of them are not able to access it. And I think that that's precisely what we're discussing. And what we have seen actually with the facilities, the long-term care facilities we have reached out to and we've received requests from, is that 64% of them were completely out of PPE nationwide. And of those places, actually a third were completely out of PPE, and we're also seeing confirmed patients with COVID that was already being confirmed. So this is particularly alarming for us because at this point, and as was stressed by Dr. Richard Pan, PPE really is our best barrier and our best option at this point to keep our communities and everyone else around safe. And so to this day, as part of GetSPP, we have been able to move close to 3 million units of PPE, but that's only a drop in the bucket of what is needed. We're only fulfilling 10% of all of our requests, as we have seen requests for up to 22 million units of PPE nationwide.
Well, thank you so much, Alize, and thank you to everyone for speaking. We will shortly open it up to some questions so people can begin to put questions in the Q&A portion. Yeah, I would just like to reemphasize that, as with the report, we have many, numbers and statistics on where we're missing PPE, but really what we're talking about is people's lives and their health and safety. And PPE is critical to protecting these residents, these workers. And while, we see a lot of statistics with this pandemic in terms of numbers, every number is a person with family, friends, hopes and dreams. And so having any shortages of PPE, especially so much in, is really just horrific. As people can go ahead and put questions in the Q&A feature, I will also just add that CalPERC Education Fund has also put together a consumer guide on questions to ask a nursing home that you're considering, as well as an explainer video on how to find information on PPE shortages, staff shortages, and outbreaks in a specific nursing home. Great. And it looks like we have a question in the chat. Yes, Senator Pan, if you can talk a little bit more, I suppose, about SB 275 and perhaps what prompted you to bring up that bill and your experience there.
Sure. Yes. So thank you, Claudia. SB 275 basically came about, again, I think as Matt said, it was sponsored by SEIU, proud to work with SEIU and other partners to say that we need to be sure we're prepared for the next outbreak. That what you saw happen with COVID was that you had a lot of facilities that were basically running on just in time. So they didn't have any stockpile at all. The state didn't have any stockpile. And then of course, we heard also about when you have a nursing home or smaller facility, you are basically outcompeted. And so you had large entities who still couldn't get PPE, right? You had the University of California, Kaiser, the state of California, all trying to find PPE. And then you had nursing homes and individual practices. And as a small business owner, who, my wife's has a practice, trying to even identify, even if you could get the PPE, you weren't sure how good it was, where is it coming from, et cetera, right? There was a lot of chaos going on. And while it was mentioned earlier that, having a state stockpile would cost some money, I would point out that a UC Berkeley study showed that the PPE we had to purchase in that time of chaos and shortages and inability to get it. And by the way, the federal government would seize your order at the dock. So even when you found something and you got delivered, it would suddenly disappear in the middle. The cost of the PPE during that time was over 6 times the cost that it would have been before the outbreak. So we were paying a lot of money to try to get PPE when people didn't have PPE. And that's what this bill is about. We actually learned from some of the countries in Asia. So Taiwan, after SARS, said, you know what, we had this problem before. We're going to require every hospital to have a stockpile PPE. Our country is going to have a stockpile PPE. So when COVID showed up, while they had a temporary shortage in the general, country, their health facilities were able to continue to run and keep their workers safe because they had that stockpile to draw upon. And that then bought time for the country and the various hospitals and other health facilities to then resecure new lines of PPE because they didn't have a shortage right away, right? They knew they had, several weeks, even, to do that. And the country as a whole was able to then gear up domestic production and be able to secure those supplies. So that's why I was saying earlier that SB 275 basically says we're going to be ready so that there's an immediate chaos. We know that people are going to need care, right? Or we can't just discharge all the nursing home patients, right? We can't just close our hospitals because there's no PPE. We need them to keep running. So we need to keep the patients and the staff safe and be sure they're not going to be exchanging this virus, right? So that will buy time while you have, the leaders of those institutions and government leaders saying, okay, now we're going to help try to reestablish that, not in a panic way because we have none, not because we have to shut everything down, but because we have some time, and then we're going to restore that supply chain. And that's what happened. And by the way, at one point in time, I think Taiwan had fewer cases of COVID than the White House did. Not the country US, just the White House itself had more cases of COVID than the entire country of Taiwan. So you can tell, there's obviously lots of other things they did as well. But I know that because I have, I know people over in Taiwan, by the way, everyone can get a surgical mask if they want it, right? We're not just talking cloth masks. They can get everybody. So we're not just talking people in health facilities because in fact, they even sent some over to the United States, all right? They were producing so much. So, we could do better. We can do better. SB 275 is about being ready. Yes, it costs some money, but it costs a lot less than what we just spent for COVID. And there will be other viruses coming over. By the way, every year we have a flu virus that comes over. Not as bad, COVID's a lot worse, but we could have a pandemic with a worse flu. By the way, be sure to get your flu shot. We don't need flu and COVID at the same time, reminder. But there are other viruses out there, right? Some worse than others. COVID, obviously a very bad one. It's very severe. And so that's why we're going through this right now. But the PPE protects against many different types of infections. And so having that available is something that keeps us safer, not only the patients and the staff of the facilities, but our entire community.
Thank you, Dr. Pan. And we have a question. With California nursing homes taking on COVID-19 positive patients discharged from hospitals, is there any research indicating that nursing homes are inadequately prepared to handle these patients? Matt, maybe I'll throw it over to you to see if, perhaps from the worker perspective, have you been seeing more COVID-19 positive patients coming into nursing homes, and what has that been?
I can't speak to the direct discharge from hospitals to nursing homes around COVID-19 patients. I know the state did a lot of guidance early on to try to mitigate the spread of COVID-19 patients to nursing homes as they're getting discharged. But patients still need to go to those facilities, if they don't have another place to go home, for example, to try to recover there if they're recovering at a SNF or a nursing home. But I think, even though there may not be research that I'm aware of, I think it's pretty clear given the number of deaths and number of worker infections and patient infections at nursing homes, still have a lot more work to do to get adequately prepared. So that both is, ensuring that they have a stockpile of PPE, but also additional training to workers that how they can, don and doff the PPE to make sure that they're doing it safely. And a number of other, patient safety, making sure that the virus doesn't get spread, trainings that workers should be able to have and make sure that they can get. So,
actually, if I may just comment on this question, one of the things that we had to balance at the beginning of the COVID outbreak here in California, which, by the way, is happening in other parts of the country right now, like Utah and Wisconsin and parts of Texas, is that the hospitals were full or getting full, right? And there are no longer any beds. So what you had to do is figure out, what do you do with patients who didn't need hospital care and where could they go, right? And again, this talks about why it's so important to be sure we have PPE up and down the whole chain, right? So because we can say, oh, great, we got all the hospitals got PPE, we're fine. No, because the problem is that if the hospitals are the only place people who are positive COVID who need healthcare could go, then the problem is they get full. And so right now we had hospitals full in Utah and in El Paso, Texas, and Wisconsin, and so forth. And you're putting up temporary, et cetera. So, so I think that there is a role for, again, it has to be done right and it has to be done safely. And that goes back to being sure you have an adequate supply of PPE so that you do have step down places where people who are positive, who after they receive, who don't need hospital care can go, but can't just stay at home. And so that's something that is important in terms of capacity. Fortunately, here in California, we never hit the point where our hospitals were completely packed. We got pretty close in some places back in the spring. But that was something that we did have to try to figure out. And again, that is the reminder about why it was so important to have that PPE supply chain. So when we talk about, where can patients go if the hospitals are full, when we had, quote, we had a testing, quote, shortage, but the real part of the problem is that we didn't have enough PPE for the people to take the test samples. So we had swab shortages and other shortages, but also you need PPE to do that as well, because the person who's getting the sample, of course, is testing someone who may be positive. That's why you're doing the test. So PPE intersects with so many different places, and that's why it was so important. And unfortunately, there was not leadership at the federal level to assure that we start ramping up the manufacturing capacity of the United States of America. This very country that was the arsenal to the world during World War II and so forth. We didn't have the national leadership to go and do that. And so that's why we're still talking right now in the end of October, when we knew there was an outbreak coming back in February, March. I think if you want to be generous, you can say March, and we're still talking about PPE shortages.
Yeah, absolutely. And then to reiterate just the part of the question, I think if there are shortages of PPE, which we know there are, then they're not prepared to protect residents and staff who may be either catching COVID-19 within the facility or returning from a hospital, perhaps with COVID-19. So then I would also like to ask the panel, as Dr. Pan has mentioned, and in the report, CalPERC Education Fund calls on the federal government to fully implement the Defense Production Act so that we can produce more PPE. For the rest of our speakers, are there any other possible policy actions or solutions that you would like to see either the federal government or perhaps here in the state of California implement in order to address these shortages and better protect residents and workers in nursing homes?
Well, I know I talked a lot. I think, there's a defense production, right? It's production and then it's distribution. And I think your report also calls out the distribution problem, right? We can produce a lot, but it doesn't go to the right place and it needs to be accessible. So we have to think about what the cost is so if we're going to charge for this PPE, then we need to be sure the nursing homes have the funding to be able to purchase it, right? As well. So we have to think about the whole distribution line, the whole supply chain. So there's production, making sure we have reliable supply, and then appropriate distribution to the places where it's needed, which of course includes nursing homes, but also includes lots of, various essential workers, et cetera, right? So when we think about how much we need to produce, obviously nursing homes should be pretty high up on the list in terms of who gets priority for it, especially given the vulnerable population, but there's also other people who need PPE as well to help prevent the spread. So we have to have a national strategy that includes not only production, but also appropriate distribution and being sure that there's sufficient financing wherever we want to put it at distribute for free, or you want to subsidize people to essentially be sure they can truly access the PPE because otherwise if they can't get it because it's either not distributed or they can't afford it, then it's not doing any good either.
So I would just echo Dr. Pan's point. And I think one of the things we found, the distribution is a huge problem, particularly to the smaller facilities. the larger facilities have, the infrastructure to be able to purchase and try to make efforts on their own, similar to what California did as a state. Of course, I think we need more national leadership. I think that's appropriate to call out both in the report and then Dr. Pan to call out here, to ensure that we have the federal government playing the role they should be playing, which is instituting the Defense Production Act, creating PPE, distributing it to the states to allow the states to distribute there. Because there's no guarantee that the federal government's going to do this, we think it's important that California develops a stockpile, which, even if it's not used, it would still, to the points Dr. Pan was being made earlier around ensuring that if you're buying it when it's not during a supply shortage, the stockpile would still be an economic benefit for 35 years, according to a UC Berkeley report. And so then we would know, and nursing homes and other health facilities would have that time to be able to allow the state to take, or the federal government to take extraordinary actions to ensure that workers have what they need. And we know that it's going to benefit both the workers, the patients, and the community to just limit the spread if you can keep it contained, because folks have the PPE that they need.
Precisely, I want to echo what has been said before, in that what we have seen to at GetSPP, since we are also dealing with distributing the PPE, right, and that's part of the role that I have in the operations department of GetSPP, is that we have seen that definitely those smaller facilities, and that includes nursing homes and long-term care facilities, as well as many others, like was mentioned by Dr. Pan, have been having difficulties accessing it. I think it has to do with access to funding. Some of them do not necessarily have the funding needed to access that PPE. Also price gouging, as was mentioned before, yes, the prices of PPE have gone way up for quality that is sometimes doubtful, especially if they're coming from foreign countries and we have very different regulations. So a lot of places are not necessarily always allowed or able to use all of the PPE that they're able to access. And then also in terms of just distribution, I think a lot of places that are more rural and maybe not in larger metropolitan areas are having a lot of difficulties accessing it. We've seen some facilities that reported having to drive for 2.5 hours to go to the only store that was available to them to get PPE. And that store was sometimes replenishing their stock only once a week, and it would be gone in a matter of 30 minutes, an hour tops. So I think in that sense, having access to PPE too is a real problem. And that's the reason why I think so much of those smaller facilities versus the larger healthcare systems have been struggling a lot still, even if PPE is available somewhere.
Well, thank you so much, Dr. Pan, Matt, and Alize, for speaking today and for sharing more about this really important problem we're dealing with. And thank you to everyone who joined the call, webinar, press conference, so many different Zoom terms today. We will go ahead and wrap it up there. I'm happy to invite anyone who wants more questions about the report or is interested in looking up perhaps data on specific